Hey everyone, welcome back to the channel. Today, we're diving into a super important topic, the warning signs of low vitamin D. You know, we always talk about eating our fruits and veggies, staying active, and getting enough sleep, but sometimes we overlook the little things our bodies need to thrive. Vitamin D is one of those things. It's absolutely crucial for our health, and many of us aren't getting enough. So in this video, we're going to explore the sneaky signs of low vitamin D and what you can do to make sure you're getting your daily dose. Let's get started. All right, let's talk about why vitamin D is so important. First of all, it's not technically a vitamin but a prohormone. What does that mean? It means our bodies can actually produce it with a little help from sunlight. Now, vitamin D plays a major role in how our bodies absorb calcium. And as you know, calcium is essential for building strong bones and preventing osteoporosis, a condition that weakens bones, making them more prone to fractures, especially as we age. But vitamin D's benefits don't stop there. It's also a key player in supporting our immune system. A healthy immune system means we're better equipped to fight off infections, viruses, and illnesses. And here's something really interesting. Emerging research suggests that vitamin D might even play a role in protecting us against certain types of cancers. So, as you can see, getting enough vitamin D is absolutely essential for our overall health and well-being. Feeling tired all the time? Like you could just crawl into bed and sleep for a week? Well, before you chalk it up to a busy schedule or too many late nights, consider this. One of the most common signs of low vitamin D is fatigue. You see, vitamin D plays a role in our energy levels. When our levels are low, we might experience persistent fatigue and low energy, even if we're getting enough sleep. Now, I know what you're thinking. Fatigue is a common symptom for a lot of different things. So how can you tell if it's related to low vitamin D? Well, pay attention to how long the fatigue lasts. If you've been feeling drained for weeks or even months and you haven't been able to pinpoint the cause, it's worth having a conversation with your doctor about getting your vitamin D levels checked. A simple blood test can tell you if you're deficient. And remember, addressing fatigue is about listening to your body and getting to the root of the problem. Let's talk about bone and back pain. Now, experiencing occasional aches and pains is a normal part of life, right? But when pain becomes persistent, especially in your bones or back, it's a sign that something else might be going on. And you guessed it, low vitamin D could be a contributing factor. Remember we talked about how vitamin D helps our bodies absorb calcium? Well, when we don't have enough vitamin D, our bodies can't efficiently absorb calcium, and that means our bones might not be getting the support they need, which can lead to weakness, pain, and an increased risk of fractures. Now, back pain is a bit more complex because it can be caused by a variety of factors, including muscle strain, poor posture, or even more serious conditions. But studies have shown a link between chronic back pain and vitamin D deficiency. So, if you're experiencing persistent bone or back pain, it's essential to talk to your doctor. They can determine the underlying cause and recommend the appropriate treatment, which might include addressing a potential vitamin D deficiency. We often think of mental health and physical health as separate entities, but the truth is they're deeply interconnected. And you know what plays a role in both? You got it, vitamin D. Research suggests that vitamin D might actually play a role in regulating our mood and emotions. There are vitamin D receptors in the brain, particularly in areas associated with mood regulation. Now, this doesn't mean that everyone with low vitamin D will experience mood changes, but studies have shown a link between vitamin D deficiency and an increased risk of depression, especially seasonal affective disorder, which is more common during the winter months when there's less sunlight. So if you're experiencing mood swings, feelings of sadness, or a lack of interest in things you used to enjoy, it's crucial to reach out for help. Talk to your doctor, a therapist, or a mental health professional. They can help you navigate these feelings and determine if a vitamin D deficiency or other factors might be contributing to your mood changes. Have you ever noticed that your cuts or scrapes seem to be taking longer to heal than usual? Or maybe you've had surgery and your recovery seems to be dragging on? Well, believe it or not, low vitamin D could be playing a role. Vitamin D is involved in the body's natural healing process. It helps regulate inflammation and supports the production of collagen, a protein that's essential for skin repair and wound healing. When our vitamin D levels are low, our bodies might struggle to heal wounds efficiently. This can lead to slower healing times, an increased risk of infection, and even difficulties with post-surgical recovery. If you've noticed a change in your body's ability to heal, don't ignore it. Bring it up with your doctor. They can assess your overall health, check your vitamin D levels, and determine if a deficiency might be contributing to impaired wound healing. Hair loss is a common concern, and it can be caused by a variety of factors, including genetics, stress, and even certain medical conditions. But did you know that a vitamin D deficiency might also contribute to hair loss? You see, vitamin D plays a role in hair follicle health. Hair follicles are tiny pores in our skin where hair grows from. Vitamin D helps to stimulate hair growth and maintain healthy hair follicles. When our vitamin D levels are low, these hair follicles can become weaker, leading to hair loss or thinning. Now, it's important to note that hair loss is a complex issue. If you're experiencing significant hair loss, it's essential to consult with a dermatologist or a trichologist, a specialist in hair and scalp health. They can help determine the underlying cause of your hair loss and recommend the most effective treatment options. We've talked about bone pain, but what about muscle pain? That achy, sore feeling in your muscles? Well, low vitamin D could be a contributing factor here too. Vitamin D plays a role in muscle function and recovery. It helps our muscles absorb calcium, which is essential for muscle contractions. When our vitamin D levels are low, our muscles might not function as efficiently, leading to muscle aches, weakness, and even cramps. Now, muscle pain can also be caused by a variety of other factors, including exercise, injury, or even certain medical conditions. But if you're experiencing persistent muscle pain without a clear cause, it's worth considering whether low vitamin D might be playing a role. Talk to your doctor. They can help you determine the underlying cause of your muscle pain and recommend the best course of treatment, which might include addressing a potential vitamin D deficiency. Do you find yourself catching every cold and flu that goes around? Does it seem like you're always battling some kind of infection? Well, a weakened immune system could be to blame, and you guessed it. Low vitamin D might be playing a role. Remember, vitamin D is essential for a healthy immune system. It helps our bodies fight off infections by regulating immune cells and reducing inflammation. When our vitamin D levels are low, our immune system might not be as strong, making us more susceptible to illnesses. Now, it's important to note that getting sick occasionally is normal. But if you're constantly battling infections or finding that it takes you longer than usual to recover from illnesses, it's a sign that your immune system might need a boost. Talk to your doctor about ways to strengthen your immune system, which might include addressing a potential vitamin D deficiency. We've talked about how vitamin D is essential for strong bones, but let's dive a little deeper into the serious consequences of low vitamin D on our skeletal health. Bone loss, also known as osteoporosis, is a condition that weakens bones, making them more fragile and prone to fractures. And you guessed it, vitamin D deficiency is a major risk factor for bone loss. When our bodies don't have enough vitamin D, they can't effectively absorb calcium, which is crucial for maintaining bone density. Over time, this can lead to a decrease in bone mass, making bones weaker and more susceptible to fractures, even from minor falls or bumps. The scary part? Bone loss often occurs silently, without any noticeable symptoms until a fracture happens. That's why it's so important to prioritize bone health throughout our lives. Make sure you're getting enough calcium and vitamin D through your diet or supplements, and talk to your doctor about getting your bone density checked, especially as you age. Weight management is a complex issue influenced by a variety of factors, including genetics, diet, and exercise. But here's another factor you might not have considered: vitamin D. Research suggests that there might be a link between vitamin D deficiency and weight gain, particularly in women. Now, the exact mechanisms behind this link are still being studied, but some theories suggest that vitamin D might play a role in regulating appetite and metabolism. When our vitamin D levels are low, it might affect our hunger hormones, potentially leading to increased appetite and cravings. Additionally, some studies suggest that vitamin D might influence how our bodies store fat. Now, it's important to note that vitamin D deficiency alone is unlikely to cause weight gain. However, it could be a contributing factor, especially if you're already struggling with weight management. So there you have it. We've covered 10 sneaky signs of low vitamin D. Remember, this video is not a substitute for professional medical advice. If you're experiencing any of these symptoms, it's essential to consult with your doctor. They can assess your overall health, order appropriate tests, and determine if a vitamin D deficiency or any other underlying conditions might be contributing to your symptoms. Taking charge of your health means being proactive. Talk to your doctor about your vitamin D levels, especially if you're at risk for deficiency. Thanks for watching. If you found this video helpful, don't forget to like, comment, and subscribe for more health tips. Stay healthy and see you next time.